Okay, let's see. Let's start. Okay, very good. Okay, as I mentioned, I'm Becky. I'm your HR representative at Resource Management, and it is time to talk about open enrollment. You all should have received an email in the wee hours of the night letting you know that open enrollment had started. So I'm just going to review some key things and talk about the plans and so forth. Okay, so just to jump right in, open enrollment is now through the 29th. That is a Monday. So if you want to make changes during open enrollment, you want to make sure you do it by the 29th. I do encourage you not to wait till the last day to do it, especially if you think you might have questions. Open enrollment is the time of year where you can make changes to your insurance plans, add plans you don't have, add dependents that are enrolled, drop coverage, all of that sort of thing without having to have a reason. The changes that you make during open enrollment take effect on October 1st, and any changes in the premiums based on what you're enrolled in, those will take effect with the first paycheck in September. So as a reminder, to be eligible for the insurance, new hires must complete the new hire eligibility period. And then once you've met that, health insurance is available to health insurance is available to health insurance is available to all full-time employees, which are all those who are working 30 or more hours a week. And then dental and vision insurance is available to full-time and part-time employees. You are able to cover a spouse to whom you're legally married. You can cover your children up to age 26, including any kids that are married. However, you cannot enroll their spouse or children. And then you can also cover a domestic partner. The only times that you can make changes to your insurance outside of being a new hire or during open enrollment is with a qualifying life event. A life event is something like a marriage, a divorce, loss of other coverage, like your spouse had coverage with another plan, and they left their job, that type of thing. So a life event request must be made in the RMI center within 30 days of the event occurring. So I know that you had a baby, and I know that you know when you had that baby. So just don't let those 30 days go by your life event without requesting it. In the RMI center, the dashboard has a big obvious tile that says life events on it. So that's where you request those outside of open enrollment. Before I dive into talking about the different plans, I wanted to talk about some cost management strategies because we're all responsible for being educated consumers of healthcare, and we all have a role in keeping the costs of healthcare low. I doubt any of you have ever walked into a car dealership and bought the first car that you looked at the first dealership you walked into. You probably did some research and so forth before you purchased your car. So health insurance you can think of the same way. With the health plans, we have two different networks that you can choose from, and I'll get into the specifics in a minute. But one thing you can do is check to see if the current doctors and facilities you go to participate on the least expensive plan or network. If all of your doctors and facilities are on the most affordable plan or network, you can save yourself some money by picking a plan on the least expensive or less expensive network. And I will be sharing these slides after the meeting so that you'll be able to access these hyperlinks, but this page does have a hyperlink to the Select Health page where you can look up providers. So just keep in mind, more expensive is not necessarily better. And like I said, I'll explain the networks here in a second. Another thing you can do is seek medical services from in-network providers and facilities instead of going out of network. Also, Select Health has a telehealth service through Connect Care. So you can use their telehealth when a physical appointment isn't needed. And there's no copay if you're enrolled on a traditional health plan. And if you're enrolled in an HSA health plan, you just have a fee of $59 until you meet your deductible. I'll also talk about Connect Care in a little more detail in a minute. Using in-network urgent care facilities or making an appointment with your doctor is always a better way to go for non-life-threatening emergencies. Use the ER only when that's kind of the only choice, when it's a life-threatening situation or nothing else is open. You can save yourself a lot of money using an urgent care, and they can do many of the same things that you'd find in the emergency room, but your wait would be less and it'll be less expensive for you. Also, you can ask your doctor to provide generic prescriptions for you when that's available. You can definitely save money if you use the generic equivalent. Also, Select Health has a mail order prescription program. So if you have drugs you take all the time, you can ask your doctor to write a 90-day supply and use the Intermountain Home Delivery Pharmacy to have your prescriptions mailed to you. And there is a little bit of a discount on the lower tier drugs, so your generics and your tier 2 brand name drugs. You actually save a little bit on copay. Plus, you don't have to go to the pharmacy every month. All right, so talking about the networks. The networks that we have are actually changing with this open enrollment. We've been offering, House of Hope has had the choice between the CARE and the Med networks. This year, the options are, we still have the Med, and we now have the value networks. The Med network provides you access to the out-of-state network that we have available through United Healthcare. So that's been the case the last few years, that the Med network is the one that gives you an out-of-state option if needed, like if you have a kid in college out of state or something like that. With the Med and the value networks, the Select Med is the green state of Utah. You see there's coverage throughout the whole state. It also gives us access to an out-of-network or out-of-state network through United Healthcare. With the Med plan, you can use it out-of-network if needed. But the plan has 40 hospitals, over 200 clinics, and over 12,000 providers. The Select Value plan has a lower monthly premium because it is offered in just 9 counties. So if you live in one of the 9 counties listed, and you'll see they're all in northern Utah, and likely all of you are in one of these counties, and they provide in-network coverage only in these counties. There are 20 hospitals, 160 clinics, and still there's over 11,000 providers. And if you look, you compare, the Med has about 1,000 more or so providers, but since it's throughout the state, it's bigger is not necessarily better. Along the Wasatch Front, you may find that all the doctors that you're using might be on both of these networks. So this is where it comes in really important for you to be aware of. You can save a significant amount of money on premium if you check and see that your doctors are on the value network, and then you can use that to reduce health costs. One thing to note, certain specialized services from the University of Utah, including Huntsman Cancer Hospital, may be included on either network, but you do need to confirm with Select Health before you seek any services at those facilities. Any of you who are currently enrolled on a plan on the Care Network will automatically be moved over to the same plan on the Med Network. So you don't have to take any action to ensure that you're still enrolled. Select Health does have a free app available for iPhone and Android. So if you haven't downloaded this, I encourage you to do that. One of the number one questions I get throughout the year is, how do I get my insurance card? So if you have the app, you can access your card on your phone. Oh, I have a new participant joining. Hang on. All right. Okay, so the app also has things like urgent care locator, medical cost estimator. It'll show you your plan usage, your claim history. It even stores your prescription information. To register, you need your member ID number, which is on your insurance card. So if you have your card, you've got what you need to register. If you find that you don't have that, you can let me know if you need that for the app. All right, I had mentioned the Intermountain Connect Care. This is the telehealth program that's available. With the telehealth, I've got on the screen just some common things you might use the Connect Care for. About a year ago, I got a bee sting and my arm like exploded. So I actually took advantage of the Connect Care and was able to use my webcam to show the bee sting to the provider, and they were able to call in a prescription for me. And it was super convenient. I didn't have to go anywhere other than straight to the pharmacy to get my prescription. So as I mentioned earlier, there's no copay for this if you're enrolled in one of the traditional health plans. And if you are enrolled on the HSA health plan, it's a $59 fee each time you use it until you've met your deductible. I do encourage you to download the app or visit the website and get registered now when you don't need to use it, because you'll find that if you're not feeling well, you might be stressed out and not wanting to fill out the short registration when you're anxious. See if I can mute those. Alrighty. As I was saying, I'd register now for that, so it's available for you to easily request care when needed if you need it in the future. All right. So there are 3 health insurance plans. The plans themselves are not changing at all, which is good news. As you probably could guess, health insurance goes up every year. So there is an increase in premium, but the nice thing is there's been no change to the actual benefits that you get in terms of your deductibles and copays. Those didn't have to go up. Another fantastic thing this year is House of Hope will be contributing towards the cost of your dependents if you are a full-time 40-hour employee. They're covering a portion of your premium if you want to cover spouse or kids. So that's new this year, so that's super awesome. And you'll be able to see in the RMI Center what those rates are for the different plans when you log in and check it out. So I did want to review these plans just to make sure everybody's familiar with what your options are. So that you can see there's 3 plans. The first two, the $1,000 and $1,500 deductible plans, those are what we call the traditional plans. And then the last column is the 1,500 HSA plan. I'm going to talk about the traditional plans first, and then I'll hit that HSA plan after I compare the first two. So with the traditional plans, the name tells you what the deductible is. So you have $1,000 deductible or $1,500 deductible. If you have family covered on your plans, those amounts double. So 2,000 family or 3,000 family. The plans have an out-of-pocket annual maximum. So that is the most that you will have to pay out of pocket in the year. Once you hit that out-of-pocket maximum, then the plan kicks in and covers the rest for you. So on the $1,000 deductible plan, it's $5,500 if you have single coverage, or $11,000 if you have family coverage, and then it's either $6,000 or $12,000 on the 1,500 plan. On all of our plans, not just the traditional, also the HSA plan, preventive services like physical each year are covered 100%. So this is like an annual physical, well, child exam. The idea is that if you're getting a physical each year, your doctor can potentially diagnose any potential problems and catch them early before they become a big deal. So that's something I encourage you to do, is take advantage of getting that annual checkup. So that again is just for like an annual physical. Now your office visits for injury or illness, then you're going to have a copay. On the $1,000 deductible plan, you have a $25 copay for a primary care physician, that's that PCP, or $35 for a secondary care physician, SCP. And then on the 1,500, it's either $40 or $50. Primary care doctors are going to be doctors such as internal medicine, family medicine, pediatricians, OBGYNs, and then secondary care are your specialists like a dermatologist or all the other ISTs out there. One thing to be aware of with your office visits, if your doctor's trying to diagnose a problem and needs to do testing like with labs or x-rays, MRIs, any of that type of stuff, that is covered 100% with the office visit copay. And that is unusual in the insurance world this day and age. Most insurance plans include something that you have to pay for that, like either your copay or part of your deductible or something. So the reason RMI has fought to keep that in our plan is we want to make sure that if you're sick and not feeling well, you're not skipping out on important testing just because you're concerned about the cost. So keep that in mind. Urgent cares, you have an office visit copay. It's the same as the specialist copay on each of these two plans, so $35 or $50. Emergency rooms, you have a copay of either $100 or $150. Then after that copay, you pay 20% of the cost of that ER visit. For your in and outpatient hospital services, maternity, you have your deductible to meet, and then you're responsible for 20%. And then you have your prescriptions. You can see you have a different dollar amount for tier 1, 2, and 3, and tier 4, you pay a percentage. Tier 1, I mentioned, were generics. Tier 2 are brand names on Select Health's preferred list. Tier 3 are brand names on the non-preferred list, and tier 4 are typically things like injectables. So those are the traditional plans in a nutshell. If you move over to the last column and look at the HSA plan, you'll see that the deductibles and out-of-pocket maximums are the same on the 1,500 HSA plan as the traditional 1,500. And again, your preventative services are covered 100%. But then if you see all the other items down the column, there's an AD for after deductible listed with every service. So you do have to meet your deductible first before those things kick in. And the idea behind an HSA plan is there's a lower monthly premium, and so that's part of why you're paying the deductible up front. You're paying more when you actually need to use the insurance. And the concept behind it is with an HSA plan, that HSA stands for Health Savings Account. You can have a bank account along with your health plan where you can save money pre-tax and use it to pay for your out-of-pocket expenses when you do have to go meet that deductible. So there are two pieces to an HSA. There's the low premium, high deductible health plan, which is the insurance piece I just talked about. And then there's a health savings account. It's an actual bank account in your name through Health Equity. And you can contribute funds into the HSA account pre-tax, so it reduces your taxable income. I like this bar graph here on this page because it helps visualize what's happening here, why this is a benefit. If you look at the first column, the traditional plan, the whole thing is blue. So all of your insurance premiums every month are going to the insurance company, regardless of how much or how little you use the insurance. With an HSA plan, you have a lower monthly premium, so you can see the blue section is lower. And the idea is the money you save in premium, you direct into your HSA account, so you have funds available to you to use when you go to the doctor. Now, to have a health savings account, you do have to be enrolled in the HSA health plan. You have to be at least 18, can't be claimed on someone else's tax return as a dependent, and you can't be enrolled in other insurance. There are a lot of benefits of having a health savings account. As I mentioned, you can direct your funds into their pre-tax, so you've got potential tax savings up to 30%. The funds roll over, they're always there for you until you spend them. There's no use it or lose it at the end of the year or anything like that. And if you stop participating in the HSA at some point in the future, either because you you just stop participating in the plan for some reason, or you leave the company or whatever it is, that account is still yours and the money is still yours to use for medical, dental, and vision expenses. Your funds are available as they're deposited. You can use it for over-the-counter drugs if you have a doctor's prescription. There's a debit card available. And once you hit certain thresholds, you can actually invest some of the funds into investment funds and earn interest. There's also a free member portal and online app through Health Equity. So if you are contributing to an HSA account and you don't have that app, I do encourage you to download that. And then one last thing with the HSA, you can start contributing to the HSA account on the first day you are effective on the HSA health plan. You can start, stop, increase, and decrease your HSA contributions at any time. And you can contribute, as I mentioned, pre-tax via payroll. You can also put funds directly in there into your account from other sources, but that would be post-tax. And then you should be aware that the IRS has contribution limits. So in 2022, if you're enrolled on the single HSA health plan, you can contribute up to $3,650. Next year, it will go up by $200. And then if you have family coverage this year, you can do $7,300. And next year, that will go up to $7,750. If you are over the age of 55, you can contribute an additional $1,000 each year. And then one last thing related to the health insurance, but not exactly. We have the Employee Assistance Program. in the past, you had to be participating in the health insurance plan to have the employee assistance plan available to you. Also, the last few years, we've been using a company called LifeWorks that's been really, they're more online based, and we haven't been in love with them. So we wanted to find a better service that has more face-to-face options for counseling help. So we will be moving to a company called Magellan. They're nationwide, and it will provide 24/7 access to employee assistance support. Employees can receive up to 5 counseling sessions per incident for common things like stress, relationships, mood issues, grief, etc. And you can have your consultations via telehealth or face-to-face. And one really important thing that's really fantastic is House of Hope is actually providing this to all full-time and part-time employees. So it's not just limited to those of you that have had the health insurance like it's been in the past. So I know that it's really important there for everyone to be healthy, not just physically, but mentally. So this will open up a new benefit for many of you that I hope you take advantage of. This will take effect on October 1st, and we'll have more information on how to actually use this service once we're closer to October 1st. So that was a long, big mouthful to talk about the health insurance. Before I move on to the dental insurance, did anyone have any questions about the health? Okay, I'm going to keep going. If you think of a question, you're welcome to ask me at the end. Okay. All right. So the dental insurance, we have been with a company called Dental Select since the dawn of time, and we're actually moving away to a company called Emeritus this year. Emeritus is a much bigger company with a nationwide presence, so the time was right for us to make the change. So any of you who are currently enrolled in a dental plan, you'll automatically get moved over to one of these new Emeritus plans. If you've had the gold plan, you'll move over to the Emeritus 1000 plan. If you've been on the platinum plan, you'll get moved over to the 1500 plan. But you can always change up what we've switched you over to. So just be aware that you're not locked into that. You can log in and change it to one of the other plans. So there is a hyperlink included in the slides for the Emeritus provider network. So you'll definitely want to use that to search for providers. Here in Utah, we use the Classic PPO and Plus network that's listed over on the side. So the first one listed is for the state of Washington, but then the second one listed is for everybody else. With the plans, the Emeritus 1500 plan and 2000 plans are very, very similar, and they're set up almost exactly like the existing platinum plan. So just to compare those two, you have a $50 per person deductible or a family max of $150. And then as the names imply, those names, the dollar amount matches what the annual maximum is. So the annual maximum is the most the plan will pay out per person per year. And then the dental plan stops covering things. Preventative services like your cleanings twice a year are covered 100%. And then for basic and major services, you have your deductible to meet. And then you're responsible for 20% after you've met that deductible for the basic work, or 50% after you've met it for your major work. On the 15 and 2000 plans, there is an orthodontic benefit for children under 19. The plan will cover 50% up to a lifetime maximum of $1,000 on the 1,500 plan or $1,500 on the 2,000 plan. There are no waiting periods for your preventative and basic services on either plan. On the 1,500 plan, you do have a year waiting period for major work or for orthodontia for kids under 19, only if you're brand new. If you've been enrolled in one of the dental select plans, the time spent on that will apply towards that waiting period. And then there's no waiting periods at all for those things on the 2,000 plan. Now, the 1,000 plan set up a little bit differently. There is no deductible on that plan. We do have an annual maximum per person of $1,000. The plan has a $10 copay for your preventative services like your cleanings. Basic work, you are responsible for 40%. Major work, you're responsible for 60%. There's no coverage for orthodontia, and there's no waiting periods on the preventative and basic services, but there is a 12-month waiting period for major work for new hires. Questions on the dental before I move on to the vision? The vision plan is also moving from Dental Select to Emeritus. The plan itself stays exactly the same. And I forgot to mention this with dental, but the dental and vision premiums are staying the same. So you won't see an increase there unless you buy up to one of the new 2,000 plan. So the plan itself stays exactly the same. You get an eye visit to the eye doctor covered each year. And then your single, bifocal, and trifocal lenses are also covered in full. They have different copay amounts for add-on things like coatings. And then you have a $130 allowance that you can use towards frames every other year or towards contacts every year. And they have some discounts if you spend more than your allowance. They also have discounts on laser vision correction. The thing that's changing with this move over to Emeritus is instead of only having the iMed network that we have had, we will have the option for a second network called the VSP network. And the main difference between the two is iMed has all your big box stores like Target. The VSP is going to have more independent vision providers, like just, regular old eye doctor that's working on his own. So if you're currently enrolled in the vision plan, you'll remain enrolled in the iMed network, but you're welcome to switch over to the VSP network if you want to during open enrollment. So I would encourage you to look at the provider networks and see which one works better for you, but the rates are going to stay the same for you on either plan. Alrighty, and then I'm looking at this slide and I realized there's one thing that's not quite accurate on here. We offer voluntary long-term and short-term disability plans. The short-term plan at House of Hope is voluntary, meaning you can opt into it if you want at your own expense. The long-term disability is actually provided by House of Hope. So before I send these slides over, I'll correct that. But the disability plans provide you 60% of your pre-disability earnings in case of injury or illness. And if you don't enroll when you're a new hire on the short-term disability, the only chance you have to sign up is you can sign up via a medical underwriting form, except we're having a special enrollment this year. So if you are not participating in the short-term disability, you can opt into it if you'd like. And again, short-term disability would be for an injury or illness that keeps you out of work more than 14 days up to 11 weeks. And then the long-term disability is for an injury or illness that keeps you out of work more than 90 days. As I said, I'm going to update the disability information to make sure it's clear that the long-term disability is something that you get signed up for when you become a full-time employee, and it's covered by House of Hope. Okay, I did want to just take a couple more minutes to talk about the RMI Center. As many of you know, we moved to a new portal earlier this year. So when we did that, you would have registered, or if you've been hired since we moved over, you would have registered when you went through your onboarding. So the username is whatever you created for yourself, as well as the password. You can click on the Forgot Username button below the Login button if you need your username, and it will be emailed to you. If you've forgotten your password, you can click on that, put in your username, and it will email you a link to reset your password. If you need help with that, you can contact anyone in the HR department for help if I happen to not be available. But once you get into the RMI Center, you can review what you currently have two different ways. Over on the left-hand side of the screen, there's a menu. You can click on Benefits and then click on Summary. Or you can get to the same place by clicking on View Benefit Summary that's on the tile in the middle of the home screen. So again, both of those take you to a summary that show you what you currently have. To actually get in and make changes, you will click on the benefit enrollment option under the benefit menu. And when you click on that, it will give you a welcome page. And essentially, you're going to be clicking next through all the different steps. So once you click next, you'll have the opportunity to add any dependents you might need to add. And then it will just take you through the different steps, health, dental, vision, etc. You will need to click through each step and make sure it's either enrolled or waived. And there should be a green check mark next to each step after you've completed it. You just want to make sure you've got all those green check marks done and that you submit it on the confirmation page to make sure all your changes are submitted. So even if you only want to change one thing, make sure you go through each of the steps. And then we also have just my contact information included with the information. So I know that was a lot in minutes, but does anyone have any questions?
Hey, Becky, this is Rourke.
Hi.
I just had a question about the new dental. Do we need to go in and change anything to cross that over to the new company, or will that automatically be done to the closest to what we already have?
It will be automatically set up for the closest plan to what you already have.
Okay.
So you only need to do something if you want a different plan. So
Okay.
I recommend every year everyone logs in and at least reviews what you have, so that you can make sure that the dental plan that you've been moved over to is the one you want.
Okay, and then I did notice on the slide there's also a link to find providers in case the dentist that we're using now is not on the list anymore.
Yes.
Okay.
Yeah, there is a hyperlink, and it tells you what to search for when you do one of those dental searches.
Okay. Thanks, Becky.
You're welcome. Did anybody else have any questions?
Hey, Becky, it's Kurt.
Hi, Kurt.
Hi. So unfortunately, I was about 20 minutes late coming into this, but is there a way for us, in case anyone needs this information, that we can get a copy of your slides? Is that possible?
Absolutely. I plan on sharing both the slides, and I made a recording of this video, so I will share both of those. I'll send them to you when I have the video downloaded, and then you can share it with whomever.
Perfect. My other question is regarding the new family benefit. Do you happen to know what that benefit actually looks like, or what the amount is that House of Hope is contributing to the family plans?
It was a nice chunk of change. Give me a second and I can tell you. Hang on a second. Just bear with me while I pull up the dollar amounts for you. Okay, so if you have single coverage, and this is for employees working 40 hours a week, if you have single coverage, the company will pay $460 a month. If you have employee plus child coverage or employee plus spouse coverage, the company will pay $860 a month. And if you are covering a family, so that's you, a spouse, and children, the company will cover $1,000 a month.
Okay. Okay.
So,
Thank you for looking those up.
yeah, so it's they've been doing the 400 some, can't remember if it was the 460 or something close to that. They've been doing that for years. So this is a really generous and fantastic benefit.
Yeah, that's just what I wanted to point out to everybody that's on this right now is that Lisa worked really hard with the board to get now partner or spouse, child, family, some sort of assistance with that insurance. And so we now finally have that. And also just wanted to point out, which Becky already really did point out, but just how great the EAP program is. We'll have more information for you later, I'm sure, but that's going to be a really great benefit, having that available for each of you. So, okay, Becky, thank you so much for that.
You're welcome. Also, I don't think I mentioned, but House of Hope has contributed to the single premium for your dental insurance. So just as a reminder, if you pick the 1,000 or the 1,500 dental plan, that single dental plan will be covered for you, and you would just pay the difference if you want to buy up to the more expensive one. And it might not be the full, then what I'm reading, I don't have the exact numbers, but just know that there is a good contribution towards dental for you as well.
Is there any vision contribution, Becky?
There is not. That one is pretty low price. So, and the one thing I'll say about vision is if you and your family don't wear glasses or contacts, it's probably not worth buying it. If you have the health insurance, you can get your eyes checked once a year under the health plan. So if all you want is that eye exam, I don't know that signing up for the vision plan makes any financial sense for you.
Great. Thank you.
You're welcome. Any other questions from anybody else? All right. If not, I'm going to go ahead and stop my recording. And